Well, our next guest has good news for anyone who's been suffering from uterine fibroids.
So July happens to be Fibroid Awareness Month. According to the National Institute of Health, about 20 to 25% of women of reproductive age have fibroids. That number jumps to 70% by the age of 50 and as high as 80% for women of color over the age of 50.
So here to tell us about an alternate treatment and their renowned specialists are based right here in New Jersey. Please welcome Dr. Dr. Rundback to the show. Good morning to you, doctor.
Good morning, Kara. Good morning, Christina. Thank you for having me on the show.
Well, thanks for being here. Tell us, what are some of the symptoms of fibroids that women should be looking out for?
Sure. Well, as you already noted, fibroids are extraordinarily common. They're benign growths of the muscle layer of the uterus. So, if they're asymptomatic, really nothing needs to be done. They're fed by estrogen, and as women approach menopause, naturally that estrogen production goes down and the fibroids get better. However, for many women suffering with fibroids, they can have symptoms that can be really disabling, very debilitating. And this includes very, very heavy periods, actually even spotting throughout the month, as well as periods that can be prolonged, often associated with so much bleeding that patients are told that they're anemic or need iron or blood transfusion. And on the other side, fibroids tend to be multiple, and even though they're benign, they can be rather large and push on adjacent things and cause symptoms such as urinary frequency or urgency, discomfort during sexual activity, low back pain, constipation, pain, and bloating. So this is not a trivial matter if you're suffering from fibroids.
Doctor, is there anything that can be done preventatively about fibroids? Is there a way to not have that happen in the first place?
Yeah, wouldn't that be great, right? Unfortunately, fibroids, like many things, are hereditary to large degrees. So there's not a whole lot that can be done. Certainly there are homeopathic, remedies once they're identified, but these are not really all that effective in preventing the fibroids in the first place. And just one of these things that if you have and you're symptomatic, then you need to address. You need to treat like any other medical condition.
Yeah. So what is the typical treatment for fibroids?
Right. Well, historically, for women who had fibroids through the years, treatment was one of two major surgical procedures. Either hysterectomy, certainly for women who are approaching menopause, which I don't need to tell you is a very invasive procedure. And obviously, from a psychological point of view, sort of giving up your uterus and potentially ovaries can, really be problematic. Or myomectomy, which is a surgical procedure where just the fibroids themselves are physically cut out and removed in the operating theater. The problem with myomectomy is it's still a surgical procedure. A lot of associated blood loss, a lot of potential complications, and very high rates of recurrence. You can't remove the entirety of the fibroid, so they tend to grow back, and it's a temporary solution. Obviously, over the last really 20 years now, we developed better minimally invasive solutions for many women who are appropriate for this that can prevent surgery, provide a nice alternative, and as we say, fewer complications, shorter recovery, and less discomfort.
So, doctor, can you explain to us in a little bit more detail what is different than about the procedure that you do? So it's not a full hysterectomy. We're not going in, cutting in, and removing the fibroid. So how is it that you guys treat them?
Sure. So the procedure that we do here at American Fibroid Centers and obviously elsewhere in the country is something called uterine fibroid embolization. So to give you some context, embolization is the medical word for blocking blood supply. Fibroids have a very rich blood supply, which is why they cause heavy bleeding, and we're blocking the blood supply in the fibroids in the uterus, so uterine fibroid embolization. And this is a minimally invasive, outpatient, non-surgical procedure. Essentially what we do is we thread a tiny little catheter. Imagine a piece of spaghetti with a hole down the middle, which is threaded from the artery, generally from the right hip, sometimes from the wrist, into the arteries supplying the fibroids, where we then are able to very selectively and very precisely block the blood supply to the fibroids. So one, they no longer bleed, and two, they no longer get the estrogen that fuels them, so they shrink and they die. The procedure takes 20 to 40 minutes. Patients go home a few hours later. They're back to work in several days, and that's obviously a much better solution than major surgery.
Technology, like we said, technology.
We've been talking tech all day. It's amazing.
Who would be a good candidate for this procedure?
Yeah, so interestingly, if you look at, how many patients undergo hysterectomy compared to uterine fibroid embolization, the number is greater than 30 to 1. I think there's an awareness problem there, which obviously here at American Fibroid Centers around the country, we're working hard to overcome. Actually, about 80% of women are good candidates for uterine fibroid embolization. You just need to see a specialist who performs these sort of procedures. Often you need an MRI to make sure that you're a good candidate. And the main reason is make completely certain there's nothing else going on which might require surgery anyway before you do a minimally invasive procedure. An MRI just gives us those high quality pictures. Sometimes women will need an endometrial biopsy if they're over the age of 40. But apart from that, there's not a whole lot of evaluation and preparation. If the MRI shows that you have fibroids and a suitable distribution, you can be a very good candidate for this minimally invasive procedure.
That is incredible. So, doctor, where can folks learn more about you, the Vascular Center, and uterine fibroid embolization? We've been practicing this word all morning.
Right. Embolization. There you go. Yes. So, I'm located at American Fibroid Centers. This particular center we have is in West Orange. We have other locations also around the state and in New York. The website is www.fibroidexperts.com. So that's relatively straightforward. Or you could just call us at 1-833-UFE-EXPERT. So that's a very easy way to reach us, and that would allow you to sort of get into the system and arrange a consultation with a physician.
Dr. John Rundback, thank you so much for your time and your insight and information this morning. We really appreciate it.
No, thank you guys. You're absolutely amazing. I appreciate it.